Good morning. I guess it's morning, it's evening, it's God only knows when it is. It is 8:41 a.m. On the 20th of April. I am back from night shift at the hospital I've been working at. I just looked at the calendar and did the math. I guess today will be day 17. So 16 are in the books. So I'm getting ready to look at 17 here. It's been eventful. Last couple of days I've been pretty baked, really tired, just feeling kind of spent, worn out. Today I feel pretty good coming off of the shift. Work's not as hard by any stretch of the imagination as it was when we first got here. We have plenty of bodies on the ground now that most of the work is a lot easier. When you only have a couple of patients to take care of, it's a lot easier than when you have, 10, 11, 12 people who are all very sick, depending on you to look after them. So that's good. We got that going for us. I think at the peak, I think there was something maybe around 4,000 nurses and respiratory therapists and nurse practitioners, physician's assistants who were here. Of course, there's also a group of physicians, some of whom are volunteering to be here. There's physicians with physicians groups that are staffing. I worked with a physician the other night who lives in LA and he flies in, but that's his, he'll often fly in here and work, be it a pandemic or not. So, but of those many people, we've lost some. I guess we're probably below 3,000 now. Maybe around 2,500. This is best guess off of different sources that people I've talked to and things that I listen to. But still a lot of stuff going on. Some people rotate out, some other people rotate in. I don't think we're at quite the high tide that we were at. There's still lots of stuff going on. Lots of sick people, lots of people that are on vents that are never going to come off. Some different things that we're trying, things that are maybe working better. We'll touch on some of that in a minute, but one of the things I really wanted to talk about today, I've been seeing and I've been trying to avoid politics as much as I can, but this has become an exceptionally political issue, just like everything else in our society. Yes, we want to open up. We want to have the minimally restrictive way of going about things that still ensures public health. But there's a lot of people who are going off half-cocked who think they understand what's going on. And I've watched the news. I've done my research. You're still an idiot. And you need to consider the fact that there's things going on that you don't understand the full totality of. There's things going on I don't understand the full totality of, so that's okay. We're learning as we go. Nobody knows the full extent of this, and sometimes when you don't know what's going on, the right thing to do is be cautious. There are, however, some things that we do know. 6 weeks ago, 8 weeks ago, many of us were like, oh, gee, I think I had this in January. I had a really bad cold, and I swabbed negative for the flu, and I bet that was Corona. Yeah, I'm sure it was. And I thought that was possible too. I don't think that's the case anymore. I really don't. And I have some really, really strong feelings as to why. This virus is highly contagious. If you are exposed to it, it is probably going to get you. It's probably going to catch you. You're probably going to get it. There's a good chance, like 75% chance that you'll have a nearly silent infection, if not a totally silent infection. That's great. That's what we want. We don't want you to get sick. There is, however, a certain number of people, some of them young, some of them healthy, some of them in good shape, who are going to get sick for real. But the numbers still ring true that 15, 20% are going to, maybe 20, 25, 20% are going to need some kind of medical attention. Of those, a statistically significant portion are going to need really aggressive medical management to not die. And even if they get perfect treatment, the cards are in some cases stacked against them so high that we cannot fix them. So how does this apply to the, I think I had this in January? Here's how this applies. If you had this in January, lots of other people around you had this in January too. So for every 100 people around you that had this, how many of them got intubated? How many of them died? How many of them ended up in an ICU for 2 weeks? The answer almost invariably is 0. And for this reason, I don't think this was what we saw in January. Because this virus doesn't give a shit. It will try to kill you. And if 100 people had it in your community, in your circle of friends, somebody's going to end up sick for real. Somebody's going to end up on a vent. Somebody is probably going to die. So if you had this in January, the people around you, you know, because somebody was going to have a bad outcome. It's not silent that way. 75% get a silent infection. Somebody in your circle of friends is going to have a bad day, period. So if you think you had it in January and you don't know somebody who died from something like a really terribly aggressive pneumonia with features of clotting problems and sepsis and diabetic ketoacidosis, I don't think you had it. So that's my personal feeling, my personal opinion, but I think that that measurement of factual reality is probably pretty damn accurate. So there's that. What about all these people that are on the internet talking about the conspiracy theories? Yesterday, a friend posted something that it curled my toenails. It was a person who they said they were a doctor. They claimed they were a medical professional. They touted themselves as an expert, and they proceeded to talk about how the coronavirus has been patented, and they went back to 2006, and they talked about, well, hey, how did they patent the coronavirus in 2006, and now it's suddenly a pandemic in 2019, 2020, and oh, gee, look at this, in 2014, some people were working on a vaccine for this. Well, isn't that amazing? Isn't that a coincidence? Boy, what does that mean? Bullshit. Guess what? 2006, 2007, SARS, it was a thing. Yes, it was a coronavirus. Guess what? A certain number of the common cold is a coronavirus. Just because it's a coronavirus doesn't mean it's this coronavirus. It is not the same. It's not the same thing. This is a new thing. So yes, there were people that were working on the coronavirus, a different coronavirus for SARS in 2006, 2007, 2008. Yes, because it was scary. We saw it and we're like, oh, damn, this could kill a lot of people. We should maybe think about preparing for that. And they did. It was the right thing to do. And now these people who, I don't know if they're maliciously stupid or they're just ignorant for no good reason, but they're going back and they're cherry picking these little bits of information and they're throwing at you like an intellectual weapon. And that's bullshit. It's 100% unmitigated, pure bullshit. And people are, this video had like 1.5 million views. And nobody had found this asshole and strung them up yet. So this is a problem. They went on to talk about the vaccines. We're talking about like MERS, which is another coronavirus that was in the Middle East, Middle Eastern Respiratory Distress. More scary shit. A coronavirus. Yes, we should be working on things for this. But using this kind of intellectually dishonest information to forward some conspiracy because you have a hard-on for a political figurehead and you want to protect them is bullshit. You're not doing anybody any favors. You're not doing your political figurehead any favors. We need to be looking at this from intellectually honest points of view. It's like if you have your kids, you love your kids. If you spoil them and if you just tell them what they want to hear, and you just give them everything they want, they're going to grow up to be wretched little shitty people. And if we do the same thing in larger society and we just bow to this lowest common denominator, whatever props up my most politically closely aligned group, if I just bow to that, we're going to be a shitty nation full of shitty people. Sadly, we're pretty much there. That's not cool. We need to cut that shit out. We need to be intellectually honest about these things. Not that I have any strong feelings there, right? No, apparently I do. So there's that. So when you see people doing stupid shit and using this intellectually dishonest crap and forwarding these bogus arguments, flip a table, scream, point, yell, cry bullshit. And don't be shy about it. Because we owe it to each other. We owe it to our kids. We owe it to the people who came before us. You know, we talk about this great American experiment and our founding fathers who gave us this great document and this great foundation that, you know, we all say that we honor and we strive to uphold. We need to start doing it. And part of being a patriot is being brave enough to say, yeah, that's bullshit. And for all of you people who are like, oh, it's my First Amendment right to be a loud dipshit who just says whatever the heck I want. Well, yeah, and the First Amendment only protects you from censorship of speech by the government. I get to tell you you're an idiot. And you might be. You might, in fact, be an idiot. I'm probably an asshole. I will own up to that, but you may well be an idiot. So be prepared to hear that. I love most of you. Some of you I'm not too sure about. Most of you I love, I care about, but we need to call this shit what it is, and it's bullshit. So what next? You know, eventful stuff at work. I've been taking care of some really sick patients. Once again, thanks to the kindness and the generosity of multiple friends, you know, who got me some really good PPE. You know, I have stuff that allows me and has allowed some other people to have basically like full laboratory grade scuba gear type stuff. I mean, just to go in there and not really worry about the level of exposure we have. You know, we're all talking about these N95 masks like they're the end all be all of PPE. They're actually pretty much their shit. It's what the hospitals give us. It's what we use for the most part. There are some hospital systems. The hospital system I'm from in Ohio that I pretty much call home. They went out of their way, and early on in this, they were able to secure good quality half-face respirators for people to use and keep. That's a good idea. That was smart. So kudos, hats off to whoever went out and made that smart purchase early, because that means all of those people don't have to buy, you know, 20,000 N95 masks to get you through this, because all those people are going to have one really good quality half-face respirator they're going to be able to use for 6 months. And not only that, it's comfortable, it fits well, it gets a good seal, and you're going to protect your people. Wow, that's smart. That's kind of nice, right? But the N95 masks that we hear about most of the time, compared to the good quality half-face respirators, full-face respirators, they're kind of garbage. You know, you're going to hear talk about fit tests and making sure that you get a good fit test. Under ideal conditions, these things are adequate. And by adequate, meaning I would not trust my life to them even if I had a good seal and a good fit test. I've pretty much never passed a fit test. I've never passed one. That's because I have a great big huge head. I wear pretty much a size 8 hat. You know, the distance from here to here is really long, and you know, with some large N95 masks, I can get a fit that if I talk like this and I keep my face really still, it'll almost seal up. It'll almost get a good seal. But when you're actually in a room working and moving and you're trying to talk to your patient, I'll never seal in one of those things. I never will. So you see other nurses, you see these pictures of these people who are, they're basically, they're taping PPE to their nose to try to get things to seal to their face, because this area right here is notoriously bad for getting good seal. You see people who have these things strapped down to their face. They have the cords that go around behind their head just really strapped down. They're trying to modify stuff to get a good seal. So you see these people with these indentations and these rubs, because we're in this PPE for like 10 hours a day, and it's not meant for that. So that's a thing. And you've also probably heard about the recommendations that we don't use nebulizers for these folks, because if you're using a nebulizer and you're breathing in and out this very fine mist of albuterol or whatever medication you're using to help open up the lungs, you are aerosolizing the virus, and it is floating around in the room. You hear similar things about the dangers of BiPAP. BiPAP and CPAP, we are by and large not doing that. They say intubate early. And for a long time, that's been kind of the way that we have rolled with this. We intubate early. Sadly, we're finding that people are going on these vents and they're not coming off. Their lungs are so brittle, their lungs are so damaged that they're not compliant. And the ventilators are actually injuring these lungs, and they're making people sicker. And people go onto a vent and they carry on for a week, and then they have a bad outcome. Some of them don't last that long. We have found that by BiPAPing them, when you are still awake and you are still breathing, and this machine is assisting in ventilation, not really forcing air in, these people are tending to have better outcomes. But it's dangerous, right? And here are the heroes who give people like me really good laboratory grade masks, like these full face masks. I mean, I've got a seal here, and I've got a full seal that goes around my forehead, down around my great big giant huge face, and down here around the bottom, and this thing locks up like a vault. Ain't nothing getting in that thing. Somebody could come in and bring mustard gas into my ER. I'd strut out of there like a boss, because I am safe in that mask. So I'm going into these rooms with these people that are on BiPAPs, and I feel comfortable with it. And other people are volunteering to say, yeah, that person's got a really good chance. Let's put them on a BiPAP. And we put them on a BiPAP. And then myself and people like me are going in there, and we're taking care of business. And so the work that you have done to help get us these special pieces of equipment are literally saving lives. Not figuratively, they are literally keeping people off of vents, and they are recovering faster, and they are going home to their families thanks to your generosity and your work. Period. So PPE makes a difference. It really does. I had a patient a couple of days ago, 75-year-old ish, in that vicinity. It was a man or a woman. They had very typical presentation. They were declining really rapidly. They were about to buy a tube. Basically, it means we were going to put them to sleep. We were going to paralyze them. We were going to use a laryngoscope to go down in and lift up their tongue and throw a tube between their vocal cords and into their windpipe, and we were going to blow up a little cuff, and we were going to breathe for them with a machine. And because of this person's age and because of their general okay, not super awesome health, they were never going to come off that vent. And it just so happened they were in a negative pressure room, and the doc's like, hey, what do you guys think? I know you guys are going to flip out. You're not going to like this, but what about BiPAP? And I'm like, let's do it. And we did it. And so I was with that person all night. I came back the next day. They felt so good. They were pissing off the nursing staff because they felt enough energy that they wanted to climb out of the bed, because they didn't want to hit the bell, and they didn't want to annoy the nursing staff. So they were trying to get out of the bed and use the urinal by themselves. And So when I got a report and I got that person back the next day, the nurse was pissed off, and I was like, good. They have enough energy to piss you off. This is a good thing. I went in and I pretty much read them the riot act. I was like, you are going to stay in this bed, and because if you don't and you come off this machine, you are going to die, and I'm not going to let that happen. I will tackle your ass and put you in this damn bed, and you are going to get better. And they bought in, and then so they understood that the reason why they were feeling better was because that machine was giving them the ventilatory support that they needed to exchange gases and let their sick, injured lungs do well enough to get better and have another day. And I was with that person all that night, and they continued to get better. They slept before I left that next morning. They hit their call light, and I went in, and they wanted to take the mask off for a minute, and they thanked me. That was pretty awesome. That was good. And that person ended up getting stepped down to a non-ICU, and they showed every sign of getting better and going home, alive, on 2 feet. So, we all have, if you talk to any nurse who's here, you can ask them a story about a patient, and everybody has a couple patients that they have stories about. Some of them did well, and some of them didn't. And for me, I think that's the patient that I'll have the story that did well. So that was good. So that's what's up with that. So we're using that PPE. We're in there. We're able to do neb treatments. We're able to BiPAP people. I feel much better when I'm going into a room where a patient's on a vent, and it's not uncommon, the vent where it locks up to the ET tube little thing, just because of the pressure and the movement, it can blow off, and it's just it's just blowing aerosolized virus like a fountain into the room. A lot of people are scared to go in there, and I don't blame them. That's not cool, but throw on the scuba gear and I go, and I feel really comfortable with it. So I've had a couple of days where I haven't felt super awesome, but overall I'm feeling pretty good. Every day I check my vitals. I look for a fever. I look for any kind of change in my baseline oxygen saturation. Every kind of ache and pain you get, you're like, what is that? Is that just the fact that I've worked like 12 hours a day over the last 16 days, and I'm just an ass beat old man, or am I getting sick? So that's kind of in the back of my head. Holy shit, I've been talking for 23 minutes. So that's what's up in New York. I'm going to jump in the shower real quick. I was kind of pissed off this morning, so I was like, I'm going to get on here and just rant for a few. So I'm going to jump in the shower. I'm going to change clothes. I'm going to go down and talk to payroll. Try to make some adjustments to my tax withholding, because New York is stealing all my damn money. These New York taxes, I don't know these guys, so going to try to figure that out. Other than that, things could be worse here. Working with a lot of great people. I think there were some people here kind of for the wrong reasons early on. I'm not sure what kind of expectations some people had about being here. This is not Club Med. You're coming into a shitstorm of a pandemic in a city that was on fire. If you thought you were going to get placed in your specialty of focus as a art therapy nurse that works with Labrador puppies, you're probably going to be disappointed, because they're not going to give you that assignment while you're here. You're going to be you're going to be slinging flesh in a med surg or an ICU or an ER, and you're going to be dealing with patients in higher numbers that are sicker than you're probably used to seeing, in conditions that you're not used to seeing. At some point, I'm probably going to do a whole post on just the New York health system. It's interesting. I dig it, but it's got its own little peculiar kinks. So some things about it I like, other things I think maybe they could do well to change, but we can get to that when we get to it. So We're coming up on 25 minutes, so I'm going to turn this damn thing off. I'm going to go get things squared away and try to get some sleep and do another one. So I'm going to be off Wednesday, so this is Monday going into Tuesday. I guess I'll do Tuesday into Wednesday. I'll have Wednesday off into Thursday, and then before too long I'll be coming home, I guess. So, but we'll see. So that's it for me in New York. Take care. Be good to each other. Love one another. Smack the shit out of somebody if they're talking stupid shit. Feel free to question stuff. Feel free to say, well, hey, what can we do to, make this lockdown easier? But let's keep our eye on what is good for society as a whole, and ourselves at the same time. So we are our brother's keepers. We are here to look after each other. And when we do, good things happen. So take care. Love y'all. Bye.